Good afternoon. No, we're supposed to start at 1, but I am so excited. I have missed you all. We're going to start a few minutes early. So as we do in every video, I'm going to give you a few seconds to receive your notifications, and we will get started shortly. Hello, Pauline and Nene and Barad and Faith. So many of you are already in the chats. So everybody, let's get started soon. And Jack, thank you for sharing that information. You are in Dubai. My brother actually lives in Dubai also. And thank you so much for saying that our Q&As just help you. So we appreciate you and good luck in your studies. And hey, Sephora, and hey, Blessing, let's get started, everybody. All right, so this one should be easy because you saw it on the title. What is the largest organ in the human body? Or shall I say on the human body? Is it going to be A, liver, B, heart, C, skin, or D, lungs? What do you think, team? And we'll reveal the answer in a few seconds. We'll reveal it in 3, 2, and if you said the skin, you are absolutely correct. So the skin is the body's serves as a protective barrier, regulates temperature, and allows for sensory perception, which is why when your patients start having skin issues, they can have systemic infections, also referred to as sepsis. So if there's a break in the skin, that infection that enters the skin can enter the bloodstream and make your patient's entire body sick. So today we are going to be covering the integumentary system. And yes, hey everybody, I have missed you all. I've been hiding, but I'm on camera today. All right, let's get started, team. Question number 2. Oh, I do apologize. This is part 2. So that's why it's starting at 52. We had an awesome session earlier this week where we did the first 50. This is part 2. Today you are in Nurse Eunice's Acute Care Center and you have 15 patients to take care of. All right, so let's go. You're in the patient's room. Which condition results from a fungal infection? Is it eczema, athlete's foot, shingles, or cellulitis? Oh, you all were fast with the answers on this one. I see the correct responses. And yes, it would be athlete's foot. And let me just hide my face. It's too close to somebody's foot. So athlete's foot is caused by a fungal infection leading to itching, cracking, and redness between the toes. So of course, as a wonderful CNA, you know if something doesn't look right, you're going to notify your nurse, okay? Keep the area clean and dry, and then tell your nurse to go in and take a look at your patient's foot because they may have a fungal infection. Which symptom is typical of oral thrush? Would it be A, white patches on the tongue or inner cheeks, B, painful blisters around the mouth, C, cracked corners of the lips, or D, red swollen gums? Hey, Vanilla Bean. All right, question 53. What do you think is a symptom of oral thrush? And Barad says A. Alan Queen says A. Yvonne says A. So here we go, everybody. Leonie says A. And you all are right. So the white patches on the tongue or inner cheeks are pretty much indicative of oral thrush caused by Candida yeast. And it presents with white, patchy, creamy patches in the mouth. So provide great oral care. And in most of your facilities, once you let your nurse know, she's going to call the doctor and we're going to get that patient a mouthwash that they can use. And that is going to help decrease some of the yeast, but also making sure that they stay well hydrated and that you remind them if they are independent to provide the oral care. And if they cannot do so without you, that and that you clean their tongue too. So you all, we have great news. Drum roll, please. Hey, Ruthline. All right, so good morning. I passed my CNA exam and got my license. Yay! You are so welcome, and I appreciate you. So thank you for tuning back in even after you passed your test. All right, everybody. Question number 54. What should a CNA do if a patient with cellulitis has a fever? And so, even if you don't know what cellulitis is, the fact that the suffix, the last ending is itis, means that it's inflammation or infection. So, something is inflamed or infected, and now they have a fever. What do you do as a CNA? Do you encourage exercise? Do you report it to the nurse? Do you apply cold packs to the area, or do you increase oral fluid intake? And D isn't wrong, it's just not the priority. All right, everybody. I see those correct answers, and you are right. Go get that nurse. We're going to report that to the nurse immediately because that fever can indicate worsening infection requiring prompt medical attention. And our elderly patients don't experience fevers the same way that those who are not elderly would. So, what is a fever in an elderly person? It's whenever their base, whatever their base temperature is, if it goes 2 degrees higher than that, we're going to be thinking that they have a fever. So an elderly person, they may not spike temperatures of 102 or 103 degrees. But if their normal temperature is 97.8 and you come in and now it's 99.8 and they're not overheated from blankets, they haven't just had a cup of coffee, because if they do, you have to wait 15 to 20 minutes before you can recheck that temperature. So if you've excluded the environmental factors and you can confirm this temperature is 99.8, more than likely they have a low-grade fever, and that is enough to get your nurse in the room. I'd rather you tell the nurse and they not necessarily, care about the information versus you have that information and you don't notify anybody, because your patient suffers if communication suffers. Let's go to question 55. What is a key intervention for preventing eczema flare-ups? You got 15 patients. One of your patients has eczema. Is it A, apply perfume-containing lotions, B, avoid all topical medications, C, use hot water for bathing, or D, keep the skin moisturized? And Eunice, you're going to do great on your test. Oh my God, you all are just so freaking awesome. Hey, Farah, congratulations. You passed your test today. I'm so proud of you. And there was a question. I'll go back and look at that one in a moment. There's a lot of questions coming through, you all, so I apologize if I missed one. But question number 55, the answer is we're going to keep that skin moisturized. So moisturization prevents dryness and irritation, which are common triggers for eczema. So you see those patchy areas on his skin. If you see that, you're going to recommend that the person put some lotion on. Don't forget to tell your nurse. Let me rephrase that. Back it up. If your nurse is already aware and there's lotion already ordered for the patient, you're going to encourage the patient to put the lotion on. If you're not sure if your nurse is aware, go and let your nurse know about that irritation, because it could be eczema or it could be a rash caused by an unknown condition. So get your nurse in the room. Question 56. Which of the following is an autoimmune condition that causes red scaly patches on the skin? So autoimmune is the key word. Is it eczema, psoriasis, rosacea, or cellulitis? So the body's fighting itself, an autoimmune response, and it's causing the skin to have red scaly patches. And because this is your first day on Nurse Eunice's acute care unit, I'm just going to tell you, it's psoriasis. So when you see this, you all, it's not infectious, but psoriasis is a chronic autoimmune condition where the immune system causes skin cells to build up rapidly, leading to scaly red patches, often on the elbows, knees, and scalp. Question 57. What is a key characteristic of basal cell carcinoma, a common type of cancer? Skin cancer, that is. So when you're doing your baths, it's important that you're looking out for abnormalities in the skin. So would a characteristic of basal cell carcinoma be A, a raised pearly bump with visible blood vessels, B, a rapidly growing dark mold, C, a painful sore that heals quickly, or D, a scaly patch that disappears when moisturized? All right, let me see. I see your question there, Gertrude. All right, so Miss Eunice, am a HCA, and I'm kindly asking if these questions I don't know what a HCA is. Some countries and some states have different terms, but if you're taking care of patients, then of course these questions are going to help you and they're going to prepare you for nursing school also. So I trick you all. I let you think you're coming in for a CNA practice test, but I'm teaching you terminology. So it's going to help you even in nursing school whenever you take your entrance exam. So let me know what a HCA is because that is not a term that I am familiar with. All right, everybody. So carcinoma. It was A. So a raised pearly bump with visible blood vessels. So if you see something like this on a patient's skin, hey, just don't look at it and be like, oh, she's probably had that forever. It could be a form of skin cancer. So let your nurse be made aware. Which condition causes the skin to lose its pigment, resulting in white patches? So everyone knows this. Is it melasma? Is it albinism? Is it vitiligo? Or is it erythema? What do we think, team? Let me see in the chat. We have a lot of B's. We have C's. And yes, this test will help you as a home care aide because home care aides take care of people with skin. And so you're sometimes the only person in the home. So you understanding the integumentary system and notifying when to recognize and when to let the nurse know something's abnormal is going to be important. So everybody, system attacks the melanocytes, leading to a loss of skin pigmentation and white patches. And a lot of you all like to ask me, Nurse Eunice, why are you teaching me all this? And I go through this in every video because it's not just about you passing a test. Once you pass your test, there's a whole human, holistic from head to toe with feelings and emotions and skin that you have to take care of. So I need you to, yes, pass your test, but do understand that you're going to have 15 patients with 15 different skin issues. And you as the CNA are so vitally important to that patient because I may not see everything. I'm not the one who's giving the baths, you are. So if you see something, say something. Let's go to our next question, team. All right, question number 59. What is a characteristic feature of cold sores? A, painful ulcers in the mouth. B, red fluid-filled blisters on the lips. C, white patches on the tongue. Or D, flaky, itchy skin. And Gertrude, I'm going to let you decide if you think this video is beneficial for you because we're going to keep studying over here, baby girl. So you can stay if you like, but you can also go with your regular professor with your HCA program. But we're going to keep on moseying on because question number 59, the answer is B. Ew. Red fluid-filled blisters on the lips. So cold sores appear as painful blisters on or around the lips caused by herpes simplex virus 1. So you all make sure that you provide great hand hygiene, wear those gloves, because that same patient who has a blister on their lip, they're going cup. Now, when you go in and follow behind them and touch the items, and then you touch your face, you just transfer this contagious virus, and now you have a cold sore also. So make very sure that you are, providing the proper hand hygiene whenever you're taking care of patients. And yes, Barad, oh my God, we are going to get it usually is going to lie dormant in our system until our immune system starts to decrease whenever we're older. But you can get cold sores also from taking care of your patients. It is contagious. Question number 60. Which of the following foods or beverages should a patient with a cold sore avoid? Would it be whole wheat toast, plain yogurt, orange juice, or steamed vegetables? All right, revealing the correct response in 3, 2, and I see a lot of right responses. Yes, you all. They shouldn't have anything acidic. So it's going to be C. It's going to be orange juice. So orange juice is highly acidic and can irritate a cold sore, causing discomfort and potentially prolonging healing. Other acidic foods and beverages, such as tomato-based products, citrus fruits, and vinegar-based dressings, should also be avoided. So if you see that irritation, you don't want to make it worse and give them something that's going to cause pain to your patient. Question 61, we have a scenario, team. Mrs. Johnson, a 72-year-old home care patient, accidentally touched the hot stove while you were preparing dinner. Look, she wanted to help you. You just turned away for a few moments and she touched the stove. She has redness on her hand and complains of pain. What is the best initial treatment for her first-degree burn? Is it A, apply butter to the burned area to soothe the pain? B, use ice to cool the burn and reduce swelling? C, run cool, not ice cold water over the burn and apply aloe vera. Don't apply aloe vera. And D, pop any blisters that form to help the burn heal faster. So this was a mistake on my part because the answer is C, but you all would not apply aloe vera. That would be something that a doctor would have to order. So I apologize for my mistake, but it's going to be C. You're going to run cool water over the burn. In a home care setting, first-degree burns should be treated by running cool water over the affected area for 10 to 15 minutes to reduce heat and prevent further skin damage. And while you're running that water over her arm, you are now going to be placing the call to the nurse at the home care company because the supervising nurse needs to come and visit the patient. Of course, you're going to get written up. An incident report will be filed to document the injury, but that doesn't mean you're going to be fired. That just means you need to be careful. And whenever you're cooking or you're in the kitchen, you probably want to have that patient seated and nowhere near the stove. So just because you get written up isn't the worst thing. It's just that we need to document the injury and prevent it from happening. Is it A, hair loss from aging? B, so you all, I was doing this at like 11 o'clock at night and it shows because I gave you the answer. Forgive me. Yeah, that one was easy. Is it C, hair loss from stress or illness, or is it D, patchy hair loss with no clear cause? Nurse Eunice needs to get some sleep. You all, it is B, hair loss from tight hairstyle. Care center and you see a hairline such as this, it is more than likely because maybe their wig, whatever, maybe their scarf, something's been irritating, or they have braided the hair too tightly. My goal for you as a CNA, because sometimes you're going to have to plait or braid your patient's hair, and if you don't know how, you will work with another CNA who can show you how to do so, is that if you're plaiting hair, that you don't plait it so tightly until you cause hair loss. So over time, this pulling damages the hair roots, causing thinning or bald spots, especially around the edges of the hairline. To prevent this, hairstyle should be loose and the hair should be given time to rest. So yes, you as a CNA, you take care of people from head to toe, and that also means that you will have to sometimes address their hair, address their wigs. For men, you will have to shave them too. Question 63. Which skin infection is caused by mites burrowing into the skin? Barack, stop laughing at me. Leading to intense itching, especially at night. Is it scabies? Is it a lice infestation? Is it herpes simplex? Or is it erysipelas? I did not pronounce that correctly. Excuse me. So which one is caused by mites burrowing into the skin? Is it A or B? I know you know it's one of the two. Revealing the answer in 3, 2, and it is A. It is scabies. So scabies is caused by a mite which burrows under the skin, leading to severe itching and a pimple-like rash. It spreads through prolonged skin-to-skin contact and requires prescription treatment. So, my dear CNAs, when you see a patient who's just itching, and you look and you see those raised bumps, I'm not going to say that you want to go ahead and start wearing some PPE, glove up, gown up, but I'm going to say get that nurse in the room really quickly so that we can actually investigate to see if this patient has scabies, if they have bed bugs, etc. Because again, whatever they have, if it's contagious, it can also get on you. Question 64. What is a key sign of a developing pressure sore on darker skin tones? And I know my team knows this. Is it A, redness that does not fade when pressed? Is it B, a raised itchy rash? Is it C, a bright white patch on the skin? Or is it D, a bluish or purplish discoloration? So we always rarely talk about pressure sores on someone who is of a dark skin tone. So what do you think, team? And everybody has it right. You all, it is D. You are correct. So on lighter skin tones, a pressure ulcer may appear as persistent redness, but on darker skin tones, it may appear as a bluish, purplish, or dark brown discoloration instead of bright red. Skin should be checked frequently for changes in texture. And also sometimes on African Americans, it can be paler. So if it doesn't appear as the same color as the surrounding tissue, that can be a sign of a pressure injury that you can let your nurse be made aware of. Question 65. A male patient reports itching and redness on his testicles. What is the most likely cause? Is it A, heat rash? Is it B, jock itch? Is it C, psoriasis? Or is it D, a bacterial infection? All right, you're at Nurse Eunice's Acute Care Center. You have 15 patients. They all have skin, and from head to toes, they could have an issue. So this patient has itching and redness on his testicles. What do you think? Itch, you have it. And no, I did not show the full genitalia because I'm not going to get banned today. All right, but jock itch is a common fungal infection that affects the groin, inner thighs, and testicles. It causes redness, itching, and rash that may spread in a ring shape. It thrives in warm, moist areas and is more common in athletes, overweight individuals, and those who sweat heavily. On himself and he's in that bed and it's all sweaty, he's going to get jock itch or a fungal infection in his groin area. Keeping the area clean and dry, and of course, once you let your nurse know, she will apply an antifungal treatment that's going to help that patient. Yes, Arlene, jock itch. Question 66. A patient taking antibiotics develops itching and yellowish drainage under her breast folds. What's the most likely cause? Is it contact dermatitis? Is it an allergic reaction? Is it eczema? Or is it a yeast infection? Let's see. Do you think yeast can grow all over someone's body, or is it just limited to the peri area? What do you think, team? Let's see. We have an allergic reaction, itching, but the yellowish drainage should kind of like clue you in that this isn't an allergic reaction. Everyone has B. Give me another answer. She's itchy, but she has yellow drainage under her breast. Yes, it is D. It is a yeast infection, you all. So, antibiotic use, whenever those patients are taking antibiotics, the antibiotics kill all the bacteria over their body, on their skin, inside of their body. And you know what that does? It allows oral thrush. It allows yeast to grow inside the body and outside the body. And so they can have an overgrowth of yeast under their breast or anywhere there's a crease and a sweaty area. So yes, the yeast infection under the breast, it can cause itching, redness, burning, and a yellowish or white drainage. So if you see this, what should you do? Let me make my camera a little bit bigger. All right, so you're going to take your patient into the bathroom if they can walk. If they're bed bound, just make sure you have multiple washcloths. You're going to use warm water, and you need multiple washcloths because if they have yeast under one breast, you don't want to spread it to the opposite breast. Notice I did not say put soap on it because it's already irritated. If you add soap, it can get worse. So you're literally going to, with the warm wet cloth, you're going to lift the breast tissue and you're going to pat. You're going to discard that one into laundry hamper, and now the yeast, and then make sure the area is dry. Something else I would recommend too is at the end, you can take a folded washcloth or a folded towel and put that beneath the breast so that some air can get to the area. And then once you're done with your bath, you can leave out and let your nurse know. But that way you can make sure it stays warm, that air, stays dry, and that air gets to it, and that you did clean it, but you didn't irritate it by adding soap. Something else you don't want to do is don't add butt paste. Butt paste is just for like the butt, the peri area. If you add butt paste between or beneath someone's breast, you just gave yeast a dark, wet place to grow. So you actually made that infection worse. All right, so I'm so happy that's new for you, Jack. And let's see what else. I have some other comments here. Yes, Eunice. And then, oh, I don't want to mispronounce your name, but Namuyiga. Next month, do you think is same like in Florida? Well, this information is just global information, and most countries utilize the U.S. standards. So we're teaching you care concepts where it doesn't matter what country you're in. If someone's on antibiotics, more than likely they're going to develop a yeast infection somewhere. And if you see it, you know how to treat it. And when I say treat it, what care to provide until you can get the nurse into the room. And then he or she will call the doctor and get an antifungal powder or something ordered. So you're just the start. But yes, I think this information is going to help you too, regardless of your state or country. Question 67. A cancer patient undergoing chemotherapy has lost their hair. What is the best way for a caregiver to support them? Is it A, avoid discussing their hair loss to prevent embarrassment? B, encourage the patient to wear a tight cap at all times? C, offer emotional support and provide options such as scarves or wigs? Or D, suggest shaving the head to prevent further hair loss? Well, Anthea, you can think that, but I want you to look it up because your skin has its own flora also. So if your skin has bacteria and the inside of your body has bacteria, and if the inside of your body has yeast, is it possible that the outside of your body could have yeast too? So you look that up and get back to me. All right, everybody. Yes, you are right. It is C, offer emotional support. So hair loss due to chemotherapy can be emotionally distressing. Caregivers should offer emotional support and provide practical solutions such as scarves, wigs, or hats while allowing the patient to express their feelings about the change. Question 68. Where should blood pressure be taken in a patient who has a mastectomy on the right side? What is a mastectomy? It is the removal of breast tissue. So someone with cancer had part of their breast removed on the right side, and now you have to go and take a blood pressure. Do you take the blood pressure on the right arm, the left arm, the right leg, or the left leg? I am so proud of you all. You're providing great care to your 15 patients at nursing. We have to go to the other extremity, you all. So it's going to be B. We're going to utilize the left arm. So after a mastectomy, especially with lymph node removal, blood pressure should be avoided on the affected side to prevent lymphedema, which is swelling on that arm due to the fluid buildup. So the opposite arm should be used instead. And don't forget to put those signs above the bed if your nurse hasn't directed you. Just as a middle note to yourself and also for the oncoming shift, they may be moving fast, that no blood pressures on the right arm. Your patients can sometimes let the caregivers know, but let's say the patient has some pain medication, they're really sleepy right now. So having that sign so that no one else comes in and does anything to the right arm is important. And normally that is a function of a CNA. Question 69. A patient with an IV in their arm reports pain, swelling, and cool skin around the site. What is the likely complication? Is it phlebitis, infection, infiltration, or air embolism? Yes, you all are going to learn these medical terms because when you walk into someone's hospital, I need you to sound knowledgeable and you're going to use these terms and you're not going to be afraid of them. So let's see the answers. I see a lot of people put B, but Catman said C and Barad said C. And hold up. I'm so Nikisha passed her test, rocking it. I am so proud of you. Congratulations. All right, everybody. So because it said swelling and cool skin, that kind of tells you it's more than just, it's not necessarily an infection or inflammation. The cool skin part comes from the fact that the IV fluids have escaped the vein and now they're in a surrounding tissue. So that is the infiltration. It has infiltrated the area where fluid shouldn't be. And so the reason why it's cool is because all those IV fluids. So you're going to see a swollen area. Sometimes it can be blistered. I want you to believe your patient. If your patient says, ouch, my hand hurts, or ouch, my arm hurts, I don't care if they're confused. Take the time to actually look at what they are talking about because the IV could have infiltrated. So infiltration occurs when IV fluid skin and sometimes itching. That means getting pale. The IV should be stopped immediately. Of course, that would be a nurse duty. The site elevated and a warm or cool compress applied as needed. So you get the nurse in the room and then she's going to give you the next interventions. All right, let's elevate it. Let me get a dressing. And now I need a new IV kit and I'll have to start an IV on the opposite arm because more than likely this person still needs intravenous therapy, even though that particular line infiltrated. Question 70. Ooh, a patient with a Jackson Pratt drain after surgery asks why they need it. And you'll see an image of it on the next slide. What is the best explanation? A, it helps to keep the wound clean by removing air pockets. B, it prevents infection by delivering antibiotics directly into the wound. C, it prevents scarring and keeps the wound edges together. Or D, it drains excess fluid and blood to promote healing and prevent swelling. Why do you think a patient would have a drain after surgery? Is it A, B, C, or D? Revealing the answer in 3, 2, and so as you're rolling, you're going to be taught how to empty and measure the contents from these drains. The goal would be once this drain is, you would empty it and then reapply the suction. Whenever you are documenting your output, your drainage, you're looking at the quantity, the color. And so let's say on post-op day number 1, your patient just came out of surgery. We would expect for those bulbs to fill up a little bit faster. Maybe you had to empty both bulbs once on your shift. But on day 2, if you're still emptying out full bulbs of bloody drainage, that probably means that there is a issue. And so as the nurse, if every time I go into the room, the bulb is empty because you're just draining it, and you're never letting me know that you drained it 3 times in one shift, I'm thinking everything's normal. So what I'm on your second day after surgery, you want to let your nurse be made aware because this patient is losing blood and they're also losing excess fluid. So let me read the description here. A JP drain removes excess fluid that can build up after surgery, reducing the risk of infection, swelling, and delayed healing. It should be emptied and monitored regularly for proper function. And if you are interested, once you go to nursing school, you want to come to Jacksonville and you need NCLEX prep, I have a full simulation lab. So I would love to have you here, but you got to be finishing nursing school before you can come to Jacksonville. And we're going to give you that extra hands-on training that you need in order to succeed as a nurse. All right, question 71. Which intervention is most important when caring for below the wound level? B, flush the drain with saline daily. C, remove the drain once the patient is feeling better. Or D, keep the drain unclamped at all times. Because you're at Nurse Eunice's Acute Care Center, and now you have a post-op patient who has a drain. How do you want that drain positioned so that gravity can help it drain? Hold up, Zabini. Oh my God, so many people have passed their test today. Today is the day. I hope that this is giving you all motivation for those of you all who haven't yet taken their test to keep doing the great work. And I am so proud of you. All right, so everybody, I hope you chose A, and you did, and you did. We're going to make sure the drain is kept lower than the wound to allow gravity to help drain the fluid properly. And again, as I said before, you're just not, oh yeah, I emptied it. It's what did you empty? Was it bloody? Was it serosanguinous, which is a little bit of blood and some. Question 7. We're going all the way to 100 questions. So a bedridden patient with a stage 2 pressure ulcer needs which of the following interventions? A, applying thick lotion to the area. B, turning and repositioning the patient every 2 hours. C, keeping the patient in the same position to prevent further irritation. Or D, massaging the area firmly to improve blood flow. Stage 2 pressure ulcer. What is the CNA's role? I'm doing my happy dance. 100% got it right. Yeah, we're going to turn that patient. So frequent repositioning reduces pressure on the affected area and prevents the ulcer from worsening. We do not massage areas that are irritated because it can damage fragile skin. So just keep that in mind. You can massage intact skin, but don't massage anything that is irritated, and especially don't massage something that is open, such as a stage 2 pressure ulcer. Question 73. What is the most common site for skin cancer to occur? Is it the soles of the feet, under the fingernails, areas frequently exposed to the sun, such as the face and arms, or is it the scalp under thick hair? Oh, this is too easy for you all. That's what I get for making test questions at 11 o'clock at night. Yes, you got it right. Yes, it is going to be C. So pretty much an area that can experience sunburn, that's going to be an area that is more likely to actually develop into an area form. So remind your patients, if you're taking them out, you're doing something, even if they are minority, they should still wear some sunscreen. Question 74. A patient with a healing wound reports yellow-green drainage with a foul smell. What should the CNA do? And the patients are going to tell you things they will not tell me as the nurse, because they know if they tell me, I'm going to tell the doctor, they're going to end up in that hospital longer. So they're going to tell you, and then you, if it's really important, need to let me know. So are you going to A, reassure the patient that this is normal wound healing? B, increase the dressing change frequency and observe? C, notify the nurse as this may indicate an infection? Or D, apply a heating pad to the wound site? Thank you for being great caregivers. Yes, your shift is almost done. You're going to notify the nurse because that yellow, green, and that foul smelling drainage, once you tell the nurse and he or she calls the doctor, we're going to get an order for a wound culture. And in some of your facilities, the CNAs can help with the wound cultures if you have been trained to do so. So you take a swab and you would get a good goop of whatever that drainage is, and you would insert it into the sterile packaging, and then you would send it off to lab. So, and sometimes you have to do 2 swabs, but if that's part of your job requirement, your nurse will teach you how to do so. Question 75, which of the following is a sign of wound healing? So we talked about all the bad stuff. How do we know if things are going right? Is it A, formation of new pink tissue? That's called granulation tissue. Is it B, redness spreading away from the wound? Is it C, swelling and pus drainage? Or is it D, a sudden increase in pain and warmth at the skin? At the site. How do we know if something is healing? Yes, you have it, Barad. I see you. Yes. Anyone else? Yep, we have Miss Benita and Leonard and Marie. And yes, you have it. It is A. So granulation tissue is a sign of healthy wound healing. Spreading redness, pus, or increased pain may indicate infection. So the others were not the correct option. Question 76. Ooh. See, we're great caregivers at Nurse Eunice's Acute Care Center. So this patient did not develop a stage 3 pressure ulcer in our care. She came into our facility with a stage 3 ulcer. So a patient with a stage 3 pressure ulcer may have which of the following? Is it A, red unbroken skin, B, an open wound extending into fat layers, C, exposed bone or muscle, swollen and painful? And wow, you all are really putting those answers in the chat. I am so proud of you. We are torn between B's and C's. So you all, a stage 3 pressure ulcer does not yet go into the bone. So it is B. So a stage 3 ulcer involves tissue loss extending into the fat layer, but bone and muscle loss are not yet exposed. So when you think of stage 4, the worst one, that's when it's in the muscle and the actual bone. So if you need to write that down to remember it, as a CNA, we don't expect you to be staging wounds, but we do expect for you to help hold the patient and provide care and comfort while the nurse is in there doing the dressing. So eventually you're going to see what one of these wounds look like, and we don't want you to be shocked when you see the bone. You can actually see the bone in someone's wound or through someone's wound. Question 77. A patient with heart failure has swollen, weeping legs with fluid leaking from the skin. What is this condition called? Is it cellulitis, necrosis, deep vein thrombosis, or third spacing? This is going to be a new medical condition for a lot of you all. This is something we really don't talk about too often, but I'm sure that you're going to see in your facilities, because we're dealing with the skin in this video from head to toe, fingernails to hair, all things in between. When your patient's legs are oozing fluid, that is a sign of Bonche. You have it. It is D. They are third spacing. You all, their legs get so swollen until the fluid has nowhere else to go except for out. And sometimes it's clear, but it is not a pleasant sight. So third spacing occurs when fluid shifts into tissues instead of staying in the blood vessels, causing swelling and fluid leakage from the skin. This can be seen in conditions like heart failure, kidney disease, and severe infections. The CNA should elevate the legs, keep the skin dry, and report any skin breakdown or signs of infection to the nurse. Yes. You have 15 patients. Your shift is almost over. It's almost time for your lunch break. Let's go. 78. A CNA notices that a dark-skinned patient's lips and nail beds look slightly gray instead of pink. What does this indicate? A, the patient is well hydrated. B, the patient may be experiencing cyanosis or low oxygen levels. C, the patient has normal skin variations. Or D, the patient has high blood pressure. Yes, everybody. Yes, you are right. So remember, brown people, we don't turn blue. And so this is the best image. I went ahead to protect this baby. I put a little cover over their eyes. But look at those lips, you all. They're dark. So in dark-skinned individuals, cyanosis may appear as gray or ashen colors on the lips, nail bed, and inside the mouth, rather than a typical bluish tint seen in lighter skin tones. If you see this, you should report it to the nurse right away. So cyanosis in different skin colors is going to look different. So I know in your textbook, cyanosis means blue, but you are rarely going to see a dark-skinned Asian, Hispanic, or African American turn blue in color. Question 79. Which area is best for assessing cyanosis in dark-skinned patients? Would it be A, and I'll take one of two answers here. Is it A, the hands and feet? B, beds? Or D, the lower legs? And I will accept two answers. So give me your best guess. So proud of y'all. I am so proud of you. I am proud of you. Yes, yes, it was C. You should be proud of yourself. Give yourself applause and high five. So, in dark skin patients, cyanosis is best detected in areas where the skin is thinnest, such as the lips, the gums, inside the mouth, and the fingernail beds. And don't forget that whenever someone has poor circulation or poor perfusion, those hands are not going to be warm. They're also going to be cool to touch. So they're going to be discolored, cool to touch. We call it mottling. So that's what you see there, M-O-T-T-L-I-N-G. And then also if you check their fingernail beds and you press on them, we call that capillary refill. So usually if you press on a fingernail bed and release within 2 seconds, the pink color should return. However, if it takes longer than 2 seconds for it to return to a pink color, that would be a sign of poor perfusion. Your nurse should be made aware. Question 80. A patient who is NPO complains of what is the CNA's best action? Is it A, apply a lip moisturizer and perform frequent oral care? B, give the patient ice chips. C, offer the patient a cup of water and ask them to take small sips. E. 4, 3, 2, and oh, you all, oh my God. Our patient's surgery was just delayed because a lot of you all gave somebody who was NPO ice chips. No, you can't give them ice chips unless it says NPO except ice chips. So if it says NPO, we don't give them anything by mouth. So if you give them something, now we have to contact the surgeon and say, hey, your patient who was scheduled for surgery can't go because our CNAs at Nurse Eunice's Acute Care Center gave the patient ice chips. So NPO means NPO unless it says something after it. If you chose A, you are right. You can moisturize their lips. So patients who are NPO cannot have food or liquids, but oral care is essential to keep the mouth comfort. Deanne, it's okay, dear. We'll make sure that we provide better care to our patient on the next shift. Question 81. A patient with swelling in their hand cannot remove their ring. What should the CNA do first? Yeah, you're calling a nurse, but while you're waiting for that nurse to get into the room, what do? Is it A, use soap and water to slide the ring off? B, elevate the hand and notify the nurse? C, cut the ring off immediately? Or D, twist and pull the ring forcefully? If you do D, I'm reporting you, period. We're not causing injury. Vanilla bean, you're going to use soap and water to slide the ring off? Vanilla bean, don't do that. Deanne, don't do that. Slide that off. So it is going to be B. Remember what elevating an extremity does? It decreases the swelling. And that's just something you're doing in the interim. So swelling can trap rings on the finger. Elevating the hand can reduce swelling and make removal easier. Forcing a ring. The nurse should be notified for further action. And you all, when you tell me and I go look at that finger, I automatically know above my pay grade, I'm calling the doctor. Hey, doctor, we have a patient here in room 355. Her name is Mary Sue. She's a new admission. Her left ring, her left ring finger has a ring on it that cannot be removed. It is stuck. I need you to come whenever you get an opportunity to come and evaluate it to see how we can safely get this ring off. Period, above my pay grade. So remember, as part of the healthcare team, you notify the nurse. When the nurse can't do something, she then notifies the physician. So this is not something that would normally be within our scope of practice. All right, question number 82. A CNA notices that a bedridden patient has dry, flaky skin. What is the best way to help? Is it A, increase bathing frequency? B, scrub the skin with a dry towel? C, use talcum powder to absorb moisture? Or D, apply lotion and gently massage the skin? Your bedridden patient, someone who cannot move without your assistance, they have dry, flaky skin. How do you help them? And everybody has it right. You are redeemed since you gave my patient who was NPO ice chips. But yeah, you're redeemed. It is D. We're going to moisturize the skin. We're going to apply the lotion, and that's going to help prevent skin breakdown and promote circulation. Do not scrub. You try to scrub it off, you're actually going to irritate. So let it slough off naturally. Let it slough off when you give them a bath, but don't just rub it off because you can actually break their skin, and that could pose them at you could put them at greater risk of getting an infection. Question 83. Your shift. This was a long shift. 15 patients. What is the best way to reduce? Is it A, keep the patient in one position? B, encourage movement and leg elevation? C, apply tight bandages to the swollen area? Or D, restrict all fluids? How do we reduce swelling without getting written up for neglect? Because if you do D and the doctor hasn't put them on a fluid restriction, that is neglect. So we only restrict fluids when the doctor gives us permission to do so. So everybody, you have it right. We're going to elevate to CNA test. We have active range of motion. That's when you can tell a patient to move their arm, move their legs. Gas pedals, act like you're driving. Let's pump the brakes. Let's pump the brakes. That's going to help with circulation for your bedridden patients. If they can move, get them up into a chair, walk them to the bathroom. But moving the limbs and elevating them helps reduce swelling by improving circulation. And we don't want to apply tight bandages because that's going to make the situation worse. What is the first sign of a pressure ulcer forming? Is it A, open wound with drainage? B, a deep crater in the skin? C, redness or dark discoloration that doesn't go away? Or D, blistering of the skin? Who knew there was so much to learn about skin? I do. I knew. You knew too. All right, so 84, yes, everybody, we know it is C. So the first sign for pressure sore is persistent redness. That means it doesn't go away. If they're light skin, it's redness. If they're dark skin, we're just going to call it discoloration. It doesn't fade, and this would indicate reduced blood flow and potential skin damage. Question 85. What is the best way to prevent skin breakdown in an incontinent patient? And before we go any farther, what does incontinent mean? Does incontinent mean that this person is wet or dry? You have an incontinent patient. And Diana, I hope you're enjoying it. You all are giving me the answers, but I need you to know what incontinent means. I see a lot of correct answers. Can someone please give me the definition of incontinent? Yes, Jermaine. Yes, Princess. Yes, Jack. The inability to control their bowel or bladder. So they can have urinary incontinence. They can also have fecal incontinence. So when someone is incontinent, let's see if I can get that off the screen. You want to do, the answer that you chose was D. You're absolutely correct. Take them to the bathroom more frequently. Remember, as a CNA, you do not catheterize patients. So the way that you would decrease incontinence is by having we call it a bowel or a bladder training program. Take them to the bathroom about every 2 hours, or often the bedpan about every 2 hours. And then after you get through helping them use the bathroom, remember that the moisture from urine or stool can lead to skin breakdown. So once they are clean, you can use a barrier cream to help keep that area protected. Yes, Anthea. Yes, great job, team. Great answers. Question 86. What is the most likely reason a patient has fecal matter in the vaginal area? My patient didn't poop on my shift, but why when I go give her bath and I spread and I see fecal matter? Why do you think that is? Is it A, the patient is incontinent and cannot action? Is it C, ding, 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 the CNA did not wipe or bathe them properly? Or is it D, the patient is sweating excessively? So that is my pet peeve. My patient hasn't had a bowel movement on my shift, but when I go in to bathe them, I see old poop. Ooh, boils my blood. Yes, everybody, that CNA, the previous person, they didn't bathe them properly. So remember, if you are not properly taking care of your female patients, if you're not cleaning them correctly, that fecal matter enters their urethra and they're going to get a urinary tract infection, which can keep and cause a bladder or a kidney infection. So I need to make sure that you wipe your patients correctly. And yes, we got a full playlist with skills videos to show you how to do so. But improper perineal care, such as wiping back to front or inadequate cleaning after incontinence, can lead to fecal urinary tract infections and skin irritation. CNA should always wipe from front to back and thoroughly clean and dry the area after toileting or bathing. And don't forget that every time you wipe a woman, you have to change the position on the washcloth. So just like with toilet paper, it's going to be outer and then change, outer and then change, center. If you still have more residue, flip it, wipe again. You still have more residue, flip it and wipe again. Keep cleaning the vaginal area with warm water and soap until there is no more residue. And after you get through washing the vaginal area, you can have them on their side and you can clean their rectum and their buttocks. Don't forget to rinse the soap off because that's going to irritate them. And of course, to dry when you are done. And if your facility allows you to put any type of protective ointment, you can do that once the patient has been dried. Question 87, you all. Whew. We have work today. Question 87. What is the best way to prevent matted hair in bed? So is it A, are we going to apply hair gel and let the hair air dry? Is it B, brush and comb the hair, keeping it clean and untangled? C, cut the patient's hair short, or D, wash the hair once per month? Looks like, yeah, it was pausing for me a little while also. So I do apologize if we're experiencing technical issues. So I see a lot of B's, and you're absolutely correct. What I do want to remind you of is that sometimes when your patient's in the ICU, we're so focused on saving that person's life until we forget that once their life is saved and they are recovering, they still want their hair. So if they have really long hair, maybe you can do a braid, put it towards the front. If you keep that hair behind them and just have it loose the entire time, it's going to end up getting matted. And now that they're better, they may have to cut their hair off. If you keep it in a ponytail with a rubber band and that rubber band is tight, well, it's going to get matted around. Go to another CNA who may know how to do so you can make sure that person's hair is taken care of, because especially if they have really long hair, one of the last things they want to do after they've recovered after a car accident is to have to cut all of their hair off. So the answer is B. And yes, I got a video on how to wash someone's hair who's in the bed. They have little portable tubs that are inflatable, and you can hang a little bag of warm water, and you can literally shampoo a patient's hair while they are bed bound. While your facility may not allow you to use this, if you're in a home care setting or if you're taking care of one of your own family members who is bed bound, that is something you can use to clean their hair. That's going to improve their confidence, and it's going to make them feel better. Question 88. Why should the water temperature always be checked before giving the patient a bath? Sherry, good luck in advance on your test. All right, so is it A, to make sure the water is cold enough to keep the patient alert? B, so that the bath water lasts longer without needing to be changed? C, because hot water kills germs better than lukewarm water? Or D, to prevent burns or discomfort from water that is too hot or too cold? Yes, Sophia and Desmond and Diana and Miss Bomina and Maxine and Marie and Yvonne, all of you all have it right. It is D. So checking the water temperature ensures the patient's safety and comfort. Water that is too hot can cause burns, especially in elderly patients with fragile skin, while cold water can cause discomfort and shivering. The recommended bath water temperature is between 90 degrees Fahrenheit and 105 degrees Fahrenheit. And for those of you all who need the numbers in Celsius, it's 32 degrees Celsius, between 32 and 40 degrees Celsius. What I do want to remind you of is that the thermometer reading is just for textbook. Your patient is the gauge. So you can stick the thermometer in the water and they can say that it's 95 degrees and you're like, perfect. If your patient says that water is too hot or if they say it's too cold, you need to adjust it. So you can use the thermometer, but the patient is the ultimate say. The patient has the ultimate say so in regards to the temperature. Whenever you are taking your CNA examination and you have to bathe the nursing dolls, the training dolls, as a reminder, your nurse will check the water temperature on behalf of the mannequin. So even though you have a mannequin laying there, you still have to ask the mannequin, would you check the water temperature? And then your nurse evaluator will do so for you. Let's make sure I haven't missed any comments. Diana says 100. Yes. All right, so question 89. Oh, y'all know my spiel. If you haven't subscribed, we're so close to 1 million subscribers. So if you haven't subscribed yet, help your nurse out. Come on, you all. I spent all this time with you all. Just press the subscribe button, press the like button, share the video with a friend, because we're going to get 1 million subscribers this summer and we're going to celebrate together. All right. Go ahead and do that right now. All right, so question 89, you all. What is the purpose of massaging the patient's back in a circular motion? Is it A, to help the patient fall asleep faster? B, to help increase blood flow and prevent pressure ulcers? C, to stretch the patient's back muscles? Or D, to entertain the patient during personal care? Why do we massage the back in circular motions? And we are torn between B's and D's. I don't think so. Maybe you're answering a different question. Yes, everybody, it is B. So circular motions, it helps to stimulate blood flow and helps to prevent skin breakdown in bed-bound patients. It can also relieve tension and promote relaxation. And I did see that I had a question, so I'm going back up now. All right. And so, Jurla, I do apologize if I mispronounce your name. You want to know the difference between a CNA and a PCT. So, you all, a CNA is a certified nurse and assistant. I'm just going to talk about for the state of Florida. For the state of Florida, in order to work as a CNA is an assistant to the nurse. So they can work in hospitals, nursing homes, home care. They can work in jails. They can work anywhere where there's a nurse, doctor's offices also. But you can't do that without taking an examination. And you have to pass a clinical test where you're actually doing hands-on skills. And then on top of that, you have to actually pass a knowledge-based test where you have to answer questions on the computer. So the PCT is a higher level of CNA. So patient care techs work in the hospital. And the reason why the hospital, and they may call them an associate care practitioner or provider or a patient care associate, but what the hospital is doing is the hospital is going to teach you more skills, such as how to draw blood, how to do EKGs. The way you get into the hospital is by having a CNA license. But based upon your CNA license, you can't do all the skills that the hospital requires you to do. So they change your title and change your job duties. And so a PCT is a hospital level CNA who can do more than what a CNA does. They can sometimes insert catheters if they're working in the ICU, if they're working in the ER, they can draw blood, they can do EKGs. Rarely in a hospital will a CNA or a patient care tech ever give medications. So that is usually left up to your LPNs and your RNs, which are two different levels of nursing. So I hope that answered your question, and you all know the difference between a CNA and a hospital level PCT or a PCA. All right, so let's keep going, everybody. Question number 90. Why should a CNA avoid massaging reddened areas over bony prominences? And a bony prominence is any place where bone is touching bone or bone is touching bedding. So we don't want to rub that because is it A, it can cause increased blood circulation, helping the redness spread. B, it is unnecessary as redness will go away on its own. C, it may indicate the beginning of a pressure ulcer and massage could cause further skin damage. Or is it D, make the patient feel uncomfortable? And then thank you, Leonie, for coming back and watching the replays. And you all have it right. I see so many right answers. It is all right. So redness over bony prominences, again, that is where bone is touching bone or bone is touching bedding, is an early sign of a pressure ulcer. Massaging the area can worsen the damage by increasing tissue breakdown. Instead, the CNA should reposition the patient frequently and report any skin changes to the nurse. Look, we have a pillow between the patient's legs. Why? Because the inner aspects of the knees, the toes, and the ankles, those are all bony prominences. And so if you allow a patient to lay on their side and their knees continually touch, they're going to get a pressure ulcer there. So when you have your patients on the side, just be mindful, even though you are turning them every 2 hours, every time they're on their side, keep a pillow between their legs to prevent bone on bone irritation. Question 91. What should a CNA or sores while bathing a patient? That is right. Just because Miss Nancy in room 503 is all sweet and innocent now, oh, she was something to be reckoned with in her 20s and 30s. So now you're bathing her and you see something that doesn't look normal. What do? A, refuse to bathe the patient and leave the room. B, wear gloves, complete the bath carefully and report the findings to the nurse. C, apply lotion to the area and continue the bath. Or D, ignore it unless the patient complains. And you all have it. You all have it. Great job, team. It is B. And so Jack has a Jackie out. Sorry if I mispronounce it. And of course, there's an ambulance. Let me mute my mic. So the question reads, how do you reposition a patient with stage 4 skin ulcer at the back without making them uncomfortable? You can't. They're going to be uncomfortable. And it's sad that more than likely the reason why they have that stage 4 ulcer is because nobody turned. It was, you would probably just go left to right, left to right. It's going to be time to digest, but then you turn them left to right again. So the way that you normally turn a person, if you come in at 8, you would have them sitting semi upright so that you can go ahead and put the towel over their chest and you can, prepare their breakfast or let them eat their breakfast, and then let their food digest, and then you can lower them down a little bit more, maybe about 30 minutes after their meal, and then you can turn them left or you can turn them right. So this is how I do it. 8 o'clock, you're on your back. 10 o'clock, you're on your side. 12 o'clock, you're on your back because you need to eat again. The next 2 hours, you're on the opposite side. So this patient, we can't put them on their back because they have a stage 4 pressure ulcer. So we're going to go side to side to side. And if you do have to put them on their back, maybe you can put like a donut or a cushion or something. But the reason why they have a stage 4 is because every time someone tried to turn them, they either fought it or they said they were in pain and the caregiver didn't do their job. So you are not alone. You're going to notify your nurse, and maybe that nurse can give them pain medicine, even if it's just a Tylenol about 30 minutes before you do exercises with this patient, or you reposition them. And hopefully that is going to make them a little more comfortable so you can reposition them without causing so much pain, but you have to turn them. All right, so team, question 92. How should a CNA respond if a male patient develops an erection during a bed bath? And it's going to happen. Is it A, immediately stop the bath and leave the room? B, ask the nurse to take over bathing the patient? C, scold the patient for inappropriate behavior? Or D, ignore it, remain professional, and continue the bath as normal? What do you think, team? And yes, I'm over here doing my happy dance because you all know that that's just a natural response. That little sweet old man is not trying to do anything to you. Now, you're going to know when to get out that room. When you feel uncomfortable, when they're saying things and there's an erection, you get out that room. But if it's just an erection, this person who hasn't been touched is now being touched. That is a natural response. So erections are an involuntary physical response and do not necessarily indicate intentional behavior by the patient. The best approach is to stay professional, continue to bath without drawing attention to it, and ensure the patient's dignity is maintained. So I will keep a towel over their genital area, bathe the rest of your body, even if the towel is tinted right now because they have an erection. That is not my focus. I'm going to wash everything else. And now this person can move at least one hand. I'm going to give him his washcloth, where it has some warm water and some soap on it, and I'm going to allow him to clean his own penis because I don't want to touch it while he's erect. And then I'll clean his testicles and then finish up the rest of your bath without being uncomfortable. And a lot of times these male patients are going to be apologetic because they know it makes them uncomfortable. Close your eyes. All right, question 93. Why is it important for a CNA to file and clean a patient's long, dirty fingernails? Is it A, to make the patient's hands look more attractive? B, to prevent infection and reduce the risk of scratching themselves or others? They could scratch you. C, to help the patient grip objects better? Or D, because family members may complain about dirty nails? I think Marclene passed her test and I must have missed it. So I see it. Congratulations. You all, I think that's almost 8 passed their CNA exam. So I am so proud of you. Barad says that is not good. You should inform the senior nurse. Barad, when you tell the nurse that your patient got erect during the bath, your nurse is going to be like, it doesn't matter who bathed them, they're going to get erect. Was the person flirting with you? Did they make you feel uncomfortable? Because it's going to happen regardless of who bathes them. If the patient isn't flirting with you, if you're not in danger, you just have to recognize it's part of your job and complete the actual task professionally. All right, so let's go to our next answer. And it is B. You all have it. So long, dirty fingernails can harbor bacteria and increase the risk of infections. Patients, especially those with weakened immune systems or poor hygiene awareness, can scratch themselves and spread germs. CNA should provide regular hand and nail care to maintain cleanliness and prevent complications. And you all do not clip anything. The only thing that you all do is file. So if that patient needs fingernails clipped, you can notify the nurse, who can then get someone in there to clip those fingernails. Question 94. Whew, we've worked the whole 12 hours. A patient with a tracheostomy has thick mucus on the trach dressing. What should the CNA do? Is it A, wipe away the mucus with a dry tissue and leave the dressing unchanged? B, remove the dressing, clean around the site with a sterile technique and apply a new dressing. C, notify the nurse as excessive mucus buildup may indicate infection or blockage. Or D, ignore the mucus unless the patient is having trouble breathing. Yes, you all are right. You all right. You don't do like the trach care. You can assist the nurse because usually we will have one person on one side of the bed and then the nurse will be on the other. But what you're going to do is you're going to make your nurse aware. So a CNA should never ignore mucus buildup on a tracheostomy dressing because excessive mucus may block the airway, cause skin irritation, or indicate infection. The CNA should report the changes in secretions such as color, odor, or thickness to the nurse immediately for proper trach care. Remember, from head to toe, you all are part of the team and you have to be monitoring all of this. Question 95. When applying TED hose, those compression stockings, what should the CNA ensure? A, the patient's legs are dry and elevated before putting them on. B, the hose are rolled down at the top for comfort. C, the patient wears them only at night. D, the hose are applied loosely to avoid discomfort. We've talked about this in other videos. What are those compression stockings used for? The fact that we say compression, that kind of tells you that maybe there is something there that needs to be squeezed. So that means they're going to be tight. Yes, TED. But TED is kind of like a brand name, so we'll call them compression stockings or TED hose. But here we go, team. Don't put lotion on their legs and then try to put the TED hose on because they're not going to go. So make sure the legs are dry. And if their legs are really swollen, maybe you can elevate them for a period of time before you put those TED hose on. But we usually put the TED hose on and usually in the morning. So at night, we may let their legs rest. But TED hose help to prevent blood clots by improving circulation. For proper application, the legs should be dry and slightly elevated to reduce the swelling before putting the hose on the patient. And they should not be rolled down and they should not be too loose. They also should not be so tight until they're causing indentations in your patient's skin. Question 96. How often should TED hose be removed to check for skin changes? Is it A, once per week, B, every 8 hours, or at least once per shift? C, only if the patient complains of pain, the patient requests to have them taken off. How often do you, the CNA, assess this patient's skin? Revealing the answer in 3, 2, and ding, ding, ding. It is B. And now if you have a 12-hour shift, don't wait to the end of your 12 hours to check their skin. So you're going to check it at least every 8 hours. So TED holes should be removed at least once per shift to check for signs, to check for skin changes, swelling or redness or sores. Remember, they can leave indentations in your patient's skin, especially if they're rolled down. And plus, you want to take them off every now and then so you can moisturize the patient's legs. If they are keeping these TED holes on 24 hours a day, we know their legs are going to be dry. So this helps prevent injuries and ensure proper circulation. If the CNA notices any signs of poor circulation or skin breakdown, they're going to report it to the nurse. Question 97. A CNA is bathing a patient with pink eye, conjunctivitis. What is the correct way to clean the patient's face? My God, we got a lot of patients with skin issues over here at our facility. So we got pink eye. What do? Is it A, wash the unaffected eye first, then the infected eye using the same wash first to prevent spreading the germs? C, use a clean washcloth for each eye and wipe from the inner to outer corner? Or D, skip washing the patient's face to avoid irritation? And remember, you never put soap on a patient's face. So there shouldn't be any irritation from just warm water. And yes, my team is freaking awesome. Yes, you have it. It is going to be C. We're going to use 2 separate washcloths. And so the eye that is infected will have its own washcloth. And when you wipe from inner to outer. You're wiping germs and bacteria, wherever that crusty, that drainage, that discharge, you're wiping it away from the eye. You're not trying to put it into the eye. So once you wipe, you put that washcloth in a laundry basket, you would get a new washcloth to clean the opposite eye. So because pink eye is highly contagious, we need to prevent the spread of the infection. So the CNA should use separate washcloths or different areas of a clean washcloth for each eye. The correct method is to wipe from inner towards the outward corner and then discard the washcloth immediately after use. Question 98. This one is for my CNAs because you all have skin too. And we're so concerned about the patient's skin until we forget that what we do and what we wear matter. So a CNA did not follow proper hygiene protocols and wore long acrylic nails. During the bed bath, their nail accidentally scratched the patient's skin, causing it to bleed. What is the correct action? A, apologize to the patient and continue the bath as usual. B, clean the wound with soap and water and apply a Band-Aid. C, cover the scratch with lotion and finish the bath. Or D, stop the bath, report the incident to the nurse, and complete an incident report. Yes, you all. Look here, don't be scratching my patients. Don't be having those long nails. This is it. This is all you all get. If you can see your fingernail over the tip of your finger, your fingernails are too long. So you all cut those nasty nails down. And even though that is cute, that is not work appropriate. I don't care if you just left a wedding yesterday, you cut them down before you come to work. So D, long acrylic nails pose an infection risk and are not permitted in patient care settings. I don't care who doesn't say anything. When OSHA comes, your facility will get cited. If you scratch a patient, you're going to get written up. If the CNA injures a patient, they must immediately report it, clean the area as directed by the nurse. We're not going to put soap on the open area. We're going to use saline and complete an incident report. CNA should keep nails short and clean to prevent injuries and the spread of infection. But Rod, stop laughing at our cohorts. Well, actually, I had a male student who had long fingernails too, and I had to talk to him about that. That is an absolute no-no. Cut those nails off. When you go to work, you go to work. Anything you want to do outside of that, you want to be pretty on the weekends, get you some customized press-on nails that can come off before Monday morning. Question 99. A CNA with long, loose hair is bathing a patient. While bending over, their hair touches the patient's genital area. Ew. What is the best way to prevent this from happening? A, wear a disposable cap while providing care. B, keep the hair tied back or secured away from the patient's body. C, wash the hair immediately after finishing the bath. D, avoid bending over when assisting with personal care. Y'all be trying to go to work and be cute. I need y'all to go to work and go to work. So if you can't bend over because your hair is just all over the place, pull your hair back. I need you to get this work done. We got 15 patients. So everybody, I don't care if you're Caucasian, African American, Asian, that's a no-no. All that loose hair, braid it, pull it back. Again, you can look good when you're not at work. I need you to be functional when you're at work. And so this is not functional. This is going to touch someone's genitals. If we're doing something, a sterile technique, your hair could actually fall in a sterile field. So loose, long hair can transfer germs and bodily fluids between the CNA and the patient, increasing the risk of infection. To maintain hygiene and professionalism, CNAs should always secure their hair away from the patient's body while providing care. I know, Barad, the hair is beautiful, but it's also germy because it touched the patient's genital area because she didn't pull it back. All right, question 100. A CNA arrives at work wearing artificial eyelashes, long acrylic nails, heavy perfume, and open-toed sandals. Oh my God, I'm sending her home right now. She is not working at our facility. What is the biggest concern regarding her attire? And I'll let you all read those. Yeah, I would send her home immediately. Yep, Diana says, hey, her up, you want to make a bun until after work. And so I'm laughing with this, but you all, we're seeing this. We're seeing people wear hair bonnets to work. We have to keep a level of professionalism. You're going to see on the next slide that I have, and yes, the answer is C. The CNA's nails, footwear, and eyelashes pose safety and also infection risk. And don't forget that we're not supposed to wear strong perfume because perfumes can trigger allergic reactions or respiratory issues in sensitive patients. And the reason I chose this image, you all, is because when you think about a patient who has maybe COVID, okay, or let's say they have the flu, and you have the mask on your face, artificial lashes. When that patient coughs, guess where the germs go? All over your face. Guess what you don't wash? Your eyelashes. So you go home with the flu on your eyelashes, lay on your pillow, and spread those germs all around your house. So if you have anything on your body or your face that you cannot wash, I need you to reconsider that, especially if you're working in healthcare. We want to keep you healthy. And yourselves and to take care of your patients and to be serious about what you do is because caring CNAs become caring nurses. And my job, my role here at Florida Training Academy is to make sure we have the next generation of nurses worldwide. I don't care where you are, the care concepts are the same. And we want you to go from level to level. Who knows, in a few years, maybe you're going to be an educator like me and you're going to be training the next generation of CNAs. So everybody, I am so proud of you. Thank you so much for tuning in. And you are so welcome. I am happy that you learned something. We try to keep it fun and engaging. And for you all who maybe know someone who speaks Haitian Creole, or maybe you are bilingual or trilingual yourself, Saskia will be on tomorrow night at 6:30, and she will be doing the translation in Haitian Creole. So we'll talk English, we'll read the questions in English first, and then we will translate them. Why are we doing that? Because we understand that people from other countries, you can do the skills, but it may be hard for you to pass the test because you don't understand the terminology. So hearing the language, hearing someone read the questions to you can sometimes help you. And don't forget that when you take your test, you can opt for an audio and oral written test. So yes, you can have a computer read the questions to you. So if you can focus on your skills and if you understand the questions better when I read them, maybe an audio test will work for you. And so you all, you know I love you. And I'm so proud to be your nursing educator. And with that, it is 2:21. We get the clock out, you all. Thank you for working today on Nurse Eunice's Acute Care Unit. Bye, everybody. Hold up, Diana. I'm so proud of you. A 97, girl. Oh, I'm proud of you. You all have a great week. Bye.